day.
Joining us now, Molly Taylor, Director for the Division of Outreach and Training with the Mississippi Department of Mental Health, and Jeffrey Harvey, Coordinator of Alcohol and Drug Prevention Services at Hinds Behavioral Health Services. Appreciate you guys coming on today. All right, so I guess the big thing is the holidays, we tend to see kind of an increase of overdoses. Is that true? And certainly abuse?
Well, and not just so much during the holidays, but, we've in the state, we've seen more opioid overdoses just in the last year. And so we really thought it was important today to talk more about how to prevent relapse for those individuals who are in recovery. And Jeffrey's going to be able to share some tips to help somebody, stay in their recovery, maintain recovery over the holidays, because it can be a really stressful time.
So just looking at the statistics here, Jeffrey, that you guys provided us, 93,331 overdose deaths in the U.S. Last year in 2020. Wow, 200 people every day from accidental drug overdoses. 134 of those involve an opioid. One death that computes out to be one death every 7 minutes. That's just staggering,
scary.
Honestly. Yeah, it very much is. So are we trending in the right or wrong direction through the years on this? Do you know?
Well, we were trending in the right direction prior to COVID.
Okay.
And that definitely increased the numbers.
Yeah.
But to be totally honest, it's probably going to get a little scarier. However, we do have resources that we're offering. Stand Up Mississippi. We have a Ground Zero opioid treatment program in Hinds County, Region 9. And we also have a lot of treatment programs for opioids.
Yeah.
That we have funds that we actually pay for their treatment. So we're doing our part in Mississippi to get those numbers back where they need to be.
And by we, you're talking about your organization, the Hinds Behavioral Health Services?
I won't take all the credit. I will give the Department of Mental Health a lot of credit for putting out funds to different regions around the state. The program that I spoke about is the program that's located in Hinds County.
Okay.
But there are other programs in the surrounding areas.
Gotcha.
Yeah.
That do the same thing we do.
So how big a problem is this, Molly, in the state of Mississippi?
So in 2020, there were 443 people that the Bureau of Narcotics reported had died from an overdose death, and 324 of those involved opioids. And so Jeffrey mentioned Stand Up Mississippi, which is an outreach awareness campaign with the Department of Mental Health and several other state agencies. And Stand Up just wants to help end the opioid crisis in our state. And there's lots of resources, as Jeffrey mentioned, to help people who maybe are struggling with opioid addiction to find the treatment that they may need. We want to let people know that there is help out there and there is hope for recovery.
Well, so what's on the boards from a legislative perspective that you guys are promoting or seeking in the upcoming session? They'll be in session here in less than a month. Is there anything in particular that you have requested that you need from the legislature?
Well, a lot of our funding comes directly from the federal government for opioid treatment and prevention programs.
Yeah.
And so we work through grant programs. And as Jeffrey said, we fund money to providers throughout the state who provide services for treatment for people who not only are addicted to opioids, but also other drugs and alcohol as well.
So are there any statistics on that illustrate the success of these programs?
Yeah, so we collect data on the number of people who have received treatment. Last year we served just over 4,000 people in our treatment centers across the state. That's a little bit down from the year before just because of COVID, and a lot of the treatment programs that are in the state had to kind of do some adjusting to be able to meet social distancing numbers and things like that. So that number is just slightly down. But, we see success every single day. And Jeffrey works with a lot of people who receive treatment services, and he sees success walking through and outside of his doors every single day. At Stand Up, we feature a lot of folks on our website, a lot of Mississippians who have gone through recovery, gone through treatment, and are in recovery now, who are living and working and living successful lives in our state every single day. And so, we want to honor those people and recognize those people.
Yeah. So, all right. So tell us, if you will, Jeffrey, about Narcan, in all caps, Narcan. What exactly is that, and what do we need to know about that?
Narcan, it is a nasal spray, and it's aimed for those individuals who are overdosing off opioids. We actually give that medication out. If you're in the Hinds County area, contact Hinds Behavioral Health Services, and we'll give you that medication. We work closely with DMH, and they fund the medication, and we give it to family members who might have one of their family members who's suffering from an opioid use disorder. I do want to go back into, because I don't want to just stay there. Some of these overdose deaths are actually happening not because of just opioids. And what I like to tell people is that, people don't understand why is there so much emphasis on opioids, and I just make it brief. Opioids most drugs will destroy your quality of life. Opioids will kill you. So drugs like Narcan, it gives people a second chance, right? If you hadn't quite, made the mark and got on the money with just complete abstinence, what Narcan does is, if you have an accidental overdose, your family member can use this medication, and it'll give you a second chance to get it right.
I got you. And so you've had success with that? I mean, there's some success stories associated with that?
We have success stories. I won't speak on, Molly would probably be more versed at speaking on programs outside of Hinds County, but I know here in Hinds County with our program, we have saw a lot of success that we do have documented data on, that we keep on these people. And I see a lot of success stories. I would be remiss if I didn't say this, and I always tell people this. I watch these people's lives transform, and they go from being, people that we basically spend tax money on to being tax-paying citizens again. I have watched people's lives be recreated, and I believe in what I do because I've created my own life. I'm just not somebody who, oversees these services. I'm one of them. I had an addiction to opioids for quite a long time, and somebody gave me a second chance. And, with that and the help of God, I was able to capitalize on it and use my experience, because the truth of the matter is, most of those clients don't care where I have a degree from here or degree from here, right? Yeah. They believe what I say have weight and depth because I've been where they at and I know a way out.
Yeah.
So we see success, every day, real life, on the front line, and it's a lot of other programs around the state of Mississippi who I fellowship with and work with them, and I know they have successes.
Yeah.
So it's all about where you look. There's a bright side to what happened this year. It showed us where the marks were that we were missing, and just like Molly said, with COVID, we were able to revamp and realize that we can't stop treating clients just because COVID happened.
Yeah.
We had to revamp, we had to redo structure our groups, and at Hinds Behavioral Health, we were able to do that relatively quickly, go to the drawing board, get them back in, and we did see some increases in urges, but I'm happy to report that we didn't see one overdose death of an individual who was in our treatment at the time.
Tell us about how do you pronounce it? OWA?
Yeah, OWAI. Yeah, OWAI. It stands for the Opioid Workplace Awareness Initiative, and that is a piece of Stand Up Mississippi that we launched just a couple of years ago. And really, the focus of that is to bring attention to occupations that have a higher risk of their employees either developing an opioid use disorder or potentially overdosing from opioids. And the reason for that is because some occupations, just by the nature of their work, like construction and manufacturing, farming, injuries are more likely in those occupations. And so we wanted to bring attention to those industries and help educate employers and employees of the risk of opioids, and talk about some other options to help with injuries other than opioids.
So I'm reading here that a total of 4,287 individuals were served in treatment during this fiscal year.
That's
residential
right.
treatment.
That's right. That's what I was speaking about earlier. We have been able in the last fiscal year to serve just over 4,000 people.
Wow.
In treatment programs that the Department of Mental Health certifies across the state. So.
Well, let's just hope that we can get people the help they need and they can access the resources they need and can kind of shake these addiction problems and re-enter into society. And congratulations to you, Jeffrey, from for your success there.
Oh, God, my man.
That's awesome.
Somebody like me came into my life. I was able to capitalize on them. And people like me and Molly, we try to go out and give that same message to those who still afflicted with those.
Inspirational story. Appreciate your giving back in that respect as well. So appreciate you guys coming on today. Thanks a lot.
Thank you so much.
We'll step aside with a break right here. We'll come right back.